How's it going, guys? We have a medium difficulty question for Pharm, Step 1, Internal Family Medicine 2CK. An 84-year-old man, he's got prostatitis. Okay, and I say it's medium difficulty because it's pretty factoidy. I didn't even go for mechanisms of action, but I'm not going to say it's pass level because, I mean, there's a significant percentage of people who just don't know how to treat prostatitis, but NBME cares, okay? Try to say amoxicillin, wrong fucking answer. This is going to be used first line for ear infections, otitis media, okay? It can also be used for strep pharyngitis. Amoxicillin clavulinate, that can be used for recurrent otitis media, can be used for sinusitis. Wrong fucking answer. Choice B, cephalosporin, wrong fucking answer. It's a third generation cephalosporin that's classically used in pediatrics. Okay, so shows up once as a correct answer on one of the 2CK forms. They give you a 12-month-old girl who has sickle cell. She missed a penicillin prophylaxis dose and ends up getting a strep pneumosepsis. And the wrong answer is penicillin for treatment. The correct answer is cephalosporin. So I've talked about this before. It's difficult stuff, but you're going to treat sepsis with a third generation cephalosporin. Ceftriaxone is your typical agent. If they give you a pediatrics case, especially under the age of 1, okay, I've said in my content under the age of 6, but don't get maniacal about the exact age. The point is, in young kids, as opposed to ceftriaxone, they can get cefotaxime as third generation cephalosporin for empiric coverage for community sepsis. Point is, wrong fucking answer. Choice C, cefoxitin, wrong fucking answer. It's a bit nitpicky. It's a second generation cephalosporin, which can be used classically for surgical prophylaxis. Okay, so it's nothing you have to specifically memorize. Just as a broad point, you could be aware that for surgical prophylactic antibiotics, they can get a first or second generation cephalosporin first, such as cefazolin. Okay, so cephalexin is your typical oral first generation cephalosporin. Cefazolin can be given IV, and cefoxitin is a second generation cephalosporin. Point is, wrong fucking answer. Choice D, Cipro, correct answer. So we treat prostatitis when the patient isn't septic with fluoroquinolone. Okay, it inhibits topoisomerase 2,4 DNA gyrase, prokaryotic, and it can cause tendinitis, okay, classically Achilles. And it's factoidy, but you need to know it. It's not pass level per se. If you knew the factoid, you say, Mike, that's hyper easy. Okay, well, there's many of you who haven't heard of that before. So Cipro, Levo, fluoxetine, they can be used for prostatitis. Levofloxacins are spiritually fluoroquinolone. It can be used, but it has better pulmonary parenchymal penetration. Cipro is classic. There's a 2CK question where they have ceftriaxone as a correct answer for pyelonephritis. So I guess I'm jumping ahead. So Cipro is used for both prostatitis and pyelonephritis, okay? If a patient is septic, it's a lengthy discussion. Okay, we're talking about SIRS criteria now. This patient's not septic. Okay, so if you have temperature under 36, greater than 38, heart rate greater than 90, respiratory rate greater than 20, leukocytes under 4, greater than 12,000, that's, if you have 2 or more of those 4, that's called SIRS. If you have an infection with SIRS, that's called sepsis. Low blood pressure with sepsis, septic shock. So the point is, if we have sepsis, you can give a third generation cephalosporin, like I talked about before, okay? So there's a question floating around where instead of Cipro, if the patient's septic, medicine 2-301 level stuff, you can give a third generation cephalosporin, but Cipro is your classic agent for both prostatitis and pyelonephritis. Let's just hop to the finalist choice. Dicloxacillin, wrong fucking answer. It's a methicillin class. Beta-lactam, heavily steric. Okay, so it's beta-lactamase resistant. It notably can treat both community staph, MSSA, as well as strep pyogenes, okay, for skin infections. So cellulitis, impetigo, erysipelas, lengthy discussion. Okay, impetigo, you can use topical mupirocin, but if we have cellulitis, let's say, you don't want to give amoxicillin or penicillin alone because 90% of community staph produces a beta-lactamase. So you can give amoxicillin clavulinate, beta-lactamase inhibitor with the amoxicillin, but You're never going to give amoxicillin, penicillin alone. You can give dicloxacillin, flucloxacillin, okay, methicillin class, heavily steric beta-lactams. This can also be used for mastitis. I've seen as a correct answer for OBGYN forms classically, community staff. Choice E, wrong fucking answer. You know the deal. To make more content, like my stuff, channel. Appreciate your time. That's it.